This is a 35-year-old woman who had liposuction of her abdomen previously with considerable improvement, but wanted additional flattening of the abdomen. So that's why this procedure is being undertaken. And as you can see right off the bat, we're making tunnels as much as possible in the long axis of the body.
The upper abdomen plays a very important role in the cosmesis of the abdominal face. I think an abdomen has also a face, and the sad umbilicus is one of the cosmetic crucial points. And when you have quite a flexible upper abdomen, which then slides down and gets stuck at the umbilicus, then you have that sad look of the upper abdomen. So what we need to do, we have to have a quite thorough fat removal to create a beautiful soft scar, which will then attach the upper abdominal skin more to the fascia and prohibit the abdominal skin from sliding down.
So the umbilicus may have a smile with the corners of the mouth down, and this is an indication that the previous liposuction has pulled that inferiorly. So to correct it, we need more liposuction of the upper abdomen.
That's correct. And the question could be, why didn't you do it in the first place? Why didn't you remove enough in the first place? But that's a very easy answer to that. It's sometimes not possible. Even if you work long enough and more, there's more blood coming, and it starts to become painful. And this is the point where you end, and then you better delay it to another session. And this is exactly what's happened here. These patients have quite a high expectation to the cosmetic result, and that's why they redo it.
Don't you think that most patients that have liposuction of their abdomen, with exception, need liposuction of both the upper and the lower abdomen at the same time?
Yes, absolutely. And also, as this is an aesthetic unit, and you, usually in a primary case, you would not be able to say the upper abdomen is a cosmetic area and the lower abdomen is a cosmetic area. It is all blending in to each other, including also the waistline. So you have to also take into account the lateral parts to see the whole body structure and configuration.
The other important thing here is, since this patient has had liposuction before, then using the powered cannula makes this case much easier. Otherwise, you're hitting a lot of fibrous tissue and makes the case very difficult.
Yeah. One thing I want to note, even if you might be irritated watching the tape, most of the removal is done from upward downwards instead of going from downwards upwards, because you intend to hit the coastal crease, and it feels very discomfortable for the patient. If you come from the upper part and you direct the cannula towards the umbilicus, you have a different kind of fat removal, and it's obviously less painful for the patient while it's being performed.
And I would think it's safer too, because you're not pointing at the liver or other structures.
Yes. So the umbilicus is another special area because it's very fibrotic. It's the natural scar everybody has of us, and there's also a lot of nerves and blood vessels included. So over a certain amount of time there is more and more fat removal, and when we lift up the umbilicus, then we can undermine that area beautifully. So we also then remove the rest of that fat.
Gerhard, there have been lots of doctors that have tried powered cannulas, and some don't like them. Do you think that's mostly a matter of inexperience, and they really haven't given them a fair chance? Because there's some people, they do 10 cases and they give it up, and other people feel that, the first 10 cases are really the learning curve.
Absolutely. The vibrating cannulas, if you look at it at the point of view of the injury, what you do to the patient by doing the performance of the surgery, is dramatically less traumatizing, less compromising the tissue by not so much injuring the blood vessels and the connective tissue, which then will also lead to a different kind of wound healing aspect. And that's very important in the upper abdomen, because we need that suspension apparatus for a good retraction during the wound healing process.
This is really a very important point that Gerhard brings up, because he's been able to demonstrate in endoscopic studies that the powered cannula really is much less traumatic to the nerves and blood vessels and lymphatics than a manual cannula, again improving the technique.